Hi, this is Dr. Malapuredi from Sigma Health Primary Care. Today I have Kim from Fambuli. Thanks for joining us today.
Hello, thanks for having me here.
So we're going to talk about the different options apart from the traditional insurance that people have to get their healthcare needs. So I'll start with my clinic, Sigma Health Primary Care. We offer membership-based concierge-style primary care services. So we see patients who are insured or uninsured and who have small businesses get our plans to get the best care they can. Apart from the traditional insurances, why they choose our clinic plan is the quality of care that they receive. But in the process, a lot of people have questions, especially from the business owners and people who rely on just our services, that what happens if they needed specialty care or emergency services. And I talk with them about other options that are available. And if you know me, I'm always looking for solutions for my patients. And in that process, I met Kim, who talked about her plans and how different they are from traditional insurance companies. And I was like, we need to introduce this to my patients. So that's the reason why I brought Kim today. Thanks for coming in again. But yeah, can you tell me more about yourself and your company, please?
Sure, yep. My name is, well, once again, I'm Kim Ruiz.
Yeah.
And our company is Fambuli Insurance Services. So we always get the question, what does Fambuli mean? So it means family, business, life. So we love helping families and businesses for life with their health insurance. And what we really love about what we do is we're brokers. And so what does that mean? So brokers means that we're not tied to any insurance company or any specific plan. So we really are able to look and structure plans based on what's best for the client.
Great.
And so one of the misconceptions we hear all the time is people feel that they all have to be on the same plan.
Yes.
And it's a beautiful thing whenever you have somebody in your corner like Dr.M, because you provide a really nice base level care. However, we can structure plans based on your family's specific needs, and not everybody in your family has the same needs, adults versus kids. And so what's really neat is we can layer on and wrap around your plan and cover those specific concerns and what might be keeping you up at night. Is it a hospital visit that you're worried about? Or you have a family history of heart attack or stroke or cancer? So we can layer on specific plans to cover each of those items.
That's amazing and great to know that it's not that all of the family members have to be on the same plan, and that doesn't have to pay the higher needs for the other family member that might be needing extra services.
Exactly.
So that's great that it is customizable in that sense. It might be obvious for people in the medical field about the cares that we provide, but I get questions like, do I prescribe medications? And that surprises me, but yes, I'm a physician. I do the prescriptions and provide all the cares that a primary care provider provides. But and on the same lines, does your plans cover prescriptions, and how is that dealt with?
Yep, no, great question. So our drug plan that's included in some of the policies would actually reimburse you per day for your prescriptions, which is really neat. And the other thing is, a lot of people forget that there's a lot of free or discounted options and websites that are out there that you have access to as well.
Okay, great. Yeah, we always talk about the discount coupons, like GoodRx coupons and things like that.
Exactly.
Even with people with traditional insurances, their copay can sometimes be a lot higher than what the coupons offer. So definitely that's a great option. So the other question is referrals. Do I provide referrals? Yes, I do provide referrals to all the specialists that they need. I can help them connect with a specific specialist if they need to, like cardiology, neurology, and all the ologies. So on the same lines, does your plan cover those referrals or our specialist cares?
Yep. And it does. So we have different plans, but yeah, in general, yes, it does cover any type of those items, any specialist visits. And the neat thing is there really is no network.
Okay.
So it would cover you wherever you have to go.
That's amazing.
Yes.
With some of these plans, it can be very restrictive where they can go, who they can see.
Yep.
So this is amazing that they can go anywhere they want. And finally, the testing, imaging, and blood work, things like that. Again, we order them, I order them, and at Sigma Health, we also offer wholesale pricing for blood tests, like a simple sodium potassium kind of test, a blood cell count test. It can range from $60 to $100 sometimes, and at our clinic, we offer it at a wholesale pricing of $2.50 to $3.50,
Yes.
which is like
Huge.
a huge discount.
Yes. Yes.
So, but on the same lines, does your plan cover like the imaging and blood work and how that works?
Yep. So it would definitely reimburse you for those items as well. And the plan that we work with also does have in-network benefits too. So not only for the blood work, but it will also do that for different types of imaging and tests, MRIs, all those things. It does offer that as well.
Okay, so when you say in-network, so you have they have contracts with certain imaging services?
You get better discounts if you go to somebody that
Oh.
knows the discounted rates.
We all like discounts.
Yes.
So yeah, sometimes this direct contracting can give you the best pricing, just like how we offer blood work. If that can be done for imaging, that's amazing as well.
Yes. So I wanted to add, did you want to talk about the disclaimer?
Oh yes, so I wanted to talk about this before, but thanks for reminding, Kim.
Sure.
Our clinic, me, and do not have any financial affiliations or benefits from Kim or Fambuli or their plans. So we don't have any. This is just purely informational to the patients who ask those questions about other options. Thank you for reminding that.
Sure, no worries, I got you.
So the final thing I wanted to touch about is limitations. Always people ask about what are the challenges with these plans?
Sure, yep. So the hospital plan that we were talking about specifically, there are limits on what it will cover for the reimbursement, so depending on the plan and the level of plan. That's why we always recommend if there's something else you're more concerned about, something major, cancer, stroke, heart attack, let's look at other plans that can cover those items specifically. And we all know that your pricing cannot be beat, and any of the other plans that are out there, which is amazing because that gives us a little bit more flexibility to find the right plans that are customized to address any of those other potential limitations that could be covered through something else at a very affordable manner.
That's amazing. Yeah, it could be like condition specific too. That's great.
Yes.
And does it exclude people if they have like family history of such conditions?
No, so it does not exclude family history. However, like any insurance, it's always good to look at these things before having a condition.
Yes.
There are some limitations on different things that could be covered. However, that's the beauty of having so many options, so we can usually find something for everybody.
Absolutely. So that's wonderful. That's great information, Kim. Thank you so much for coming in today. I'll put a slide with her details, how you can reach her. And she's local in Leesburg, is that right?
Actually, South Riding.
South Riding, okay,
Yes.
sorry. So South Riding, very close here, so you can reach her by phone no matter where you are, so you'll get more information that way. But thanks for joining, and let me know if you have any questions. All right, you have a great day.